Welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at Murray County Medical Center, and I'm here with Tom Bergman, and we're going to talk about bone and joint health and some maintenance care items today. Hello, Tom.
Hey, how's it going?
It's going. How are you?
I'm good. So just a brief bit of my history. I went to the University of South Dakota and got a degree in physical therapy and practiced out by with the Mayo Clinic for about 6 years. Have a lot of dedicated orthopedic experience by doing that. And then shortly thereafter, I went and did the physician assistant training, and here I am. So part of what I wanted to just make my pitch on was commitment to diet and exercise. There are books galore, and it seems like lots of people have opinions on this, and the information is available everywhere. But I think, long story short, is, having an appropriate lifestyle and using our bodies the way that they were meant to be used is going to be, most of the time, better than most meds used for metabolic syndromes, for weight loss, for lots of different problems, diabetes, a lot of those things. And there are ways to do it for most people. We just have to be creative. So, going out and running 5 miles for me might be the hardest workout I've ever done, but for Amber, it's just her warm up. So I think it's all relative, and we have to try to find a way to schedule it. Essentially, that's how I've had most of my success. And whether you're a morning person or an afternoon person, it doesn't matter that much. But have some method of accountability and just making goals and things. And it's important to be purposeful. So if we're trying to exercise to improve our heart health, there's ways to do it. If we're trying to lose weight, it's going to look a little different. And whether it's getting a consult from somebody here, because many of the providers are well aware of strategies for that. Plus, as far as, nutrition and dietary specifics, we have a diabetic educator here who's very good, and appointments can be made at any time. I think would be helpful for a lot of people. So that's my exercise pitch. And then another pitch I wanted to make was pertaining to being hurt versus being injured. Now, it kind of deals with exercise. That's how I'm tying it in here. But there's a difference between hurt and injury, and it's basically subjective versus objective. And in order to really know if you have something that really is there and significant and needs to be addressed, you basically need to have someone that knows look at it. Seems pretty straightforward. We have imaging modalities here that are rare for a hospital in a town this size. We have an MRI machine, a CT scanner. We have ultrasound services, obviously X-ray, lots of things that could be utilized to investigate a whole plethora of problems, and can be done without referrals to places that are distant.
Those are all available on an on-call basis, correct? So if I came in and had a broken foot, I wouldn't necessarily have to wait.
No, especially X-rays. Those are usually pretty standard and can be done right away. Some of the other more detailed scans like CTs and MRIs, you have to get authorization through insurance. But generally that can be done oftentimes within the next day. And as far as staying in the orthopedic area, we do have an orthopedic specialist that comes between here and Marshall and has been around a long time, and I respect quite a bit, and he's a good resource. Dr. Wakama has done a lot of different things, and I'd have no problem sending a family member of mine for a consult from him. And then just personally, with my therapy background and just some of the specific things I did in my training, I do a lot of joint injections and casting, taping, splinting, obviously exercises for specific things. Pretty diverse knowledge in those areas. We also have good physical therapists downtown that we make referrals to on a regular basis, very capable. It's a good facility down there, right next to the dental office. Lots of good equipment and can meet the needs of a lot of, I think, what the community is looking for. And then moving on from there, I don't want to linger too long on this point, but just wanted to bring it up that there's a difference between health care and sick care. And if you think about it, that should be fairly obvious that one is proactive and one is reactive. And, with my pitch about diet and exercise, that's being proactive. If we, do the things that we're supposed to do and schedule our exercise and pay attention to our diet and all those things, it's much more beneficial than I think what we give it credit for. So, we do have to, play the hand we're dealt genetically, but lots of things that we can do on our own to be healthier. And finally, I just wanted to mention a few maintenance care items that are available that I wouldn't say everyone takes advantage of. And just real quickly, this will be somewhat chronologically, but after probably 35 years of age, most of us qualify for maintenance blood work. So looking at blood sugar, cholesterol, different things based on our family history, thyroid, those kinds of things. And it's good to do at certain intervals. And if you come and see your primary care provider, they can stay on top of that for you and keep track of it and build a history. Let's see here. Some of there's a heart and vascular screen coming up on February 15th here, and that just has a kind of a superficial look at heart function, some of our vessels. It's very convenient that that's going to be available. Some other things that we qualify for from an insurance standpoint would be ultrasound screenings for aneurysms, as well as low-dose CT scans if we have ever used nicotine products, and there's some stipulations to that. You have to be, I believe, a 50 for the ultrasound and 65 and a certain number of smoking pack year history to qualify for that, and that looks for, the low-dose scan looks for cancers of our lungs. And the ultrasound, of course, would be for aneurysms, which can develop and a lot of times don't have any symptoms until it's too late. Some other things that we do here, colonoscopies, EGDs, Dr. Snow does them. There's a maintenance schedule that they moved up the colonoscopies from 50 to age 45, and even earlier if you have a family history. So not as bad as it sounds. Can be good for bowel health, for the cleanse. But generally it's worth doing. Let's see here. Pulmonary function tests for asthma and COPD. Our respiratory team can do those and determine if a person would benefit from inhalers, essentially, or kind of see where we're at functionally with our lungs. And then we do a number of cosmetic procedures, including laser hair removal, Botox injections, skin revitalization, spider vein correction, a whole kind of variety of things that could definitely get utilized. I think for the most part that's all I wanted to mention, but maintenance care is very important. Take advantage of what your insurance companies will cover, and a lot of times most of these things fall under that. You just have to ask, but definitely being proactive is I would say better than reactive as far as managing your health.
That's kind of on that annual basis as far as insurance goes, correct?
Correct. Some of them, based on response or what the results are, would be every 3 or perhaps 5 years. In some instances, like for example with a clean colonoscopy, that's every 10. But it varies, and we would definitely keep track of that for you.
Sounds good. Do you have anything else to add before we wrap up?
I don't think so. If you have any questions, feel free to call us.
Sounds good. Thank you for your time, Tom.
Oh, you're welcome.
And if you'd like to make an appointment at Murray County Medical Center for any of those preventative screenings that Tom mentioned, or just a regular clinic checkup, feel free to call the clinic at 507-836-6153. That's 507-836-6153.